According to medical professionals, the pandemic's effect is currently weakening. They have assumed that it will disappear on its own. An Italian infectious disease doctor believes that the pandemic has become less dangerous and could disappear on its own without a vaccine. Dr. Matteo Bassetti, the head of the infectious diseases clinic at the San Martino Hospital, has stated that the pandemic appears to have become less potent, possibly due to genetic mutations. His clinical impression is that the pandemic is changing in severity. In March and early April, the patterns were completely different. People were coming to the emergency department with a very difficult to manage illness, and they needed oxygen and ventilation. Some developed pneumonia. But he has said that in the past month, the picture has completely changed in terms of patterns. It was like an aggressive tiger in March and April, but now it's like a wild cat. Even elderly patients aged 80 or 90 are now sitting up in bed and they are breathing without help. The same patients would have died in 2 or 3 days before. He has said that one of the reasons for the pandemic becoming weaker could be that it has mutated in response to social distancing measures. I think the pandemic has mutated because our immune system reacts to the pandemic and we have a lower viral load now due to the lockdown, mask wearing, social distancing, and so forth. We still have to demonstrate why it's different now. It is possible that the pandemic will be eradicated before researchers find a vaccine. We have fewer and fewer people being infected, and it could end up with the pandemic dying out. But another expert was less optimistic about the prospect of the pandemic disappearing so soon. He stated that it could take years. In response to Dr. Bassetti, he stated, "I don't expect it to pass away that quickly. It will if it has no one to infect. If we have a successful vaccine, then we'll be able to do what we did with smallpox. But because it's so infectious and widespread, it won't go away for a very long time." Let's review the statistics. More than 8 million cases have been confirmed worldwide, including at least 435,000 persons who have passed. Nearly 2.1 million cases have been recorded in the United States, and this includes 116,000 persons who have lost their lives as a result of the infection. In China, Beijing is reintroducing strict lockdown measures and rolling out mass testing to beat back a fresh cluster of cases. A childhood syndrome has been linked to the infection, and this may take weeks to show up. A baffling condition called multi-inflammatory syndrome in children, MIS-C, started showing up in children about 3 weeks after the peak of the infection having passed through, a team at a large New York health system has reported. The team at Northwell Health reported on 33 cases of the syndrome, which many doctors believe is some sort of delayed response to the infection. All of 33 children recovered with treatment. The doctors claimed that the pediatric department at Northwell's Cohen Children's Medical Hospital in New Hyde Park are mystified by what was happening. They have stated that they were pretty shocked as it was playing out. The whole syndrome came out of the blue. We had been comfortable for months, believing that the children weren't affected by the infection. The low moved to an intense level when the flow of affected children peaked at about 5 weeks after the infection hit New York City and the surrounding areas hard. These are families, I am sure, who thought they were off the hook. Many showed up in shock with plummeting blood pressure that required immediate treatment. They treated the children as they were coming in having no idea what it was. As many other medical centers have reported, the symptoms at first look like Kawasaki disease, a rare syndrome that usually affects very young children. They were treated as though they had Kawasaki disease despite the age range. The children with MISC range in age from 2 to 17. Almost all had gastrointestinal pain and diarrhea. They also had clear evidence of inflammation as shown on blood tests, and 79% of them required intensive care. All tested positive for the infection. Sklein said that the team excluded a handful of other children who did not test positive. Other teams have reported that the MISC patients had no symptoms of infection before, but that most of them later tested positive for antibodies to the pandemic, indicating a past infection. All got treatment of some sort, including aspirin and intravenous immune globulin, IVIG, a standard Kawasaki treatment. Some also got the antiviral remdesivir or strong anti-inflammatory medications normally used to treat conditions such as rheumatoid arthritis. All recovered, and Sklein said he does not know which treatments helped or hurt. Some may have heart damage. They are all going to be seeing cardiologists for a while. He said that parents and pediatricians need to make sure that any children with lasting fevers and diarrhea get examined right away. A closely watched model that predicts that the pandemic is now forecasting there will be more than 201,000 loss of life in the United States by October 1. The projections continue to show that the fall is going to be difficult, with a sharp rise in daily loss of lives forecast in September and October. Last week, the model from the Institute for Health Metrics and Evaluation at the University of Washington predicted that 170,000 persons will lose their life during this same period. The model was often cited by the White House early in the pandemic and is one of 19 models currently featured on the U.S. Centers for Disease Control and Prevention website. As of today, the model projects that 201,129 people will pass from the pandemic in the U.S. by October 1, with a possible range of 171,551 to 269,395 loss of lives. Ali Mokad, one of the model's creators, said that they've raised the number of projected loss of life for two reasons. There is increased mobility and premature relaxation of social distancing, which has led to more infections that we see being played out in Florida, Arizona, and other states. This means more projected loss of lives. The second part is that we are now projecting to October 1st, which means that an increase in this wave will result in our starting point for the second wave. So the second wave will be higher, and we are capturing parts of that. Remember, second wave starts at the end of August, early September. The daily loss of lives are expected to decrease through June and July and remain relatively stable through August, but the model forecasts a sharp rise in loss of lives through September. In the model, projected daily loss of lives nearly double from 743 on September 1 to 1,241 on October 1. The model's uncertainty does increase the farther out it projects in time. To make the model, analysts use cell phone data to show people's increased mobility. As people move around, they have a higher chance of coming into contact with someone who is sick, but it isn't entirely clear exactly how mobility responds with infections. Wearing a mask and physical distancing can reduce the rate of disease transmission. The IHME has also said that it looks at those factors in making the model, including the numbers of people who wear masks, air pollution figures, testing, pneumonia trends, and population density, among other factors. The IHME model has been criticized for some of its assumptions and predictions. At one point, it projected that loss of lives would stop in the summer. Many experts at the time called that unrealistic. Since then, the IHME has revised its methodology. It has been stated that it is important for people to remember to remain cautious without interacting with others. We all need to wear our masks and stay away from each other to reduce the circulation and to be in a better place at the beginning of the second wave. This has been a review of the health issues across the globe and the current situation it presents. Thanks for watching. Like, comment, share, and subscribe.